So what would it be like for somebody seeing you versus what we've kind of described already? The medical system, it's you're in and out. The doctor doesn't have much time. It's not his fault. It's just a system. What is the difference when somebody comes to your clinic versus the standard medical clinic?
Yeah. First appointment is 45 minutes. And
Wow.
again, it's covered by your insurance. All you're paying is your copay out of pocket. I do a complete medical history on you, a review of systems. I try to figure out how sugar toxicity is manifesting in your body specifically, because it's different for everyone genetically. I do a complete what I call food history. Okay. And we discuss what your exact goals are for this. Weight loss always comes last. Okay. We focus on health first. And then first appointment, I get all of that. And then I teach you how to correctly and safely wean off of your carbs and sugar. And in my practice, we do this over a 2-week period. Okay, thereafter, I follow up with them first 2 weeks and then every 4 weeks. And then we slowly start to spread that out over time. Because remember, again, I'm trying to cut the umbilical cord at some point. Like little bird, right? My keto baby, go and you fly free and you live correctly. All follow-up appointments are 30 minutes. We do labs. We see how you're doing. My partner is a cardiologist. We do all the cardiac testing on you if we feel it's appropriate. Most of my patients do cardiac testing every year. And just like Dave Feldman, but not in a study format, we have shown that with keto and carnivore, you can reverse cardiovascular disease in several different parameters. And we have even shown reversal of plaque in major arteries.
Wow. Wow. Okay.
Mm-hmm.
I'm really glad you brought this
It doesn't
up.
matter if your LDL, it doesn't matter if your LDL is 50 or 350. None of my people are on a statin. The people that come to me refuse to take a statin, right? That's what we see. Through cardiac testing, not a blood draw. A blood draw doesn't tell you anything. You've got to do imaging. You've got to get on the treadmill. You've got to do all these things. That's cardiac testing, not a blood draw.
And it's independent of LDL cholesterol. LDL cholesterol could be across the board in a crazy wide range. That range that you just said is huge.
Yeah, huge. It's huge. We focus on lowering triglycerides, getting HDL higher if we can. We focus hugely on fasting insulin and insulin resistance. And of course, everyone's blood sugars and A1Cs eventually get into the normal range. So this societal, national focus we have on LDL, wow. Wow. Talk about missing the mark.
Well, it's keeping the trillions of dollars going, right? If that one card falls, so many cards fall. Like it's huge to be able to keep that going. So what at this point, from where you are and what you've observed and what you've seen in your clinic, what are you comfortable saying about LDL cholesterol? What do you feel just you can say this and not really have too much doubt about it?
Yeah. Okay. Tim Noakes showed a video at one of the conferences. And when he showed this video, I had this immediate flashback to school. They showed us the same video in school. And I was like, I think everyone forgot about this video. And it talked about how sugar, when it flows in your bloodstream through your veins and arteries, it creates damage. Picture sugar as these little shards of glass. And as it's flowing in your blood through your veins and arteries, it creates little nicks, okay? Your body interprets that as damage. So then your body will send all of your immune cells to the area to fix the damage. LDL, primarily made by the liver, by the way, he's just cruising by. Like, there's already this plaque that's forming of immune response. In the face of sugar, LDL particles become a little stickier, whatever. They change in size. There's a lot of changes that happen when you're marinating in sugar. It affects everything, including your LDL particles. It gets stuck to the plaque. It's not the cause of the plaque. It got stuck to it. It was already there. So we've been able to prove this, right? That when you can positively affect change in blood sugar and things like insulin resistance. It doesn't matter what your LDL is. You will not have plaque buildup, damage to the chambers of your heart valves. You know, we've seen reversal of heart failure in our patients. And you think of how much money is spent in cardiology drugs alone, right? And the whole time, because we focused on LDL and we forgot about sugar, we were missing the mark. Now, here's the other thing people need to understand. If I'm a cardiologist, I'm going to focus on your cholesterol count. I'm not going to pay attention to your A1C and blood sugar. I don't want to step on anyone's toes, so I'm going to leave that up to your PCP and your endocrinologist. So it's this problem of everyone is working in silos and they're not looking at the whole patient. That's a common theme. We hear about it all the time. This is just another example of that.
Wow.
So
That
my
was
patients will stay on a statin. If they come to me on a statin, they will stay on a very low dose until we can get their blood sugars down within a certain range. Only then legally do we feel comfortable pulling them off of it. So just to kind of cover our butts legally for a while, they'll stay on low dose, not no 80 milligrams atorvastatin, none of that. I'm talking 10 until we can get their blood sugars down. Then boom, they come off. And that's motivating for them. That's incentive because they want to get off their meds or let's do this. I want to get off this statin. What do I need to do? What do I need to stop eating? Right? So it's good. It all works out.
Wow, that's incredible. What kind of side effects do people notice, especially once they come off of the medication? Do they realize how much the statin was affecting things like their brains or their muscles or things like that?
Yeah. So, okay, the muscle pain, muscle weakness, I would say is the most common thing. But most patients will not stay on the statin if that starts happening early on. They'll mention it to their PCP. The typical course of action is their PCP will take them off of atorvastatin and put them on rosuvastatin, which is generic Crestor, which seems to have less muscle-related side effects. If not that, they'll put them on ezetimibe, which is generic Zetia, okay? But there's always going to be something on board because we're so scared of cholesterol, right? We don't understand it. And so that we tend to see a lot of that with the muscle pain, muscle weakness. Do we notice changes in memory and cognitive function? I don't know if you can attribute that to just coming off of a statin, because think about how much more nutrition people are getting. We teach them the right healthy fats, right? And the right amounts from something as simple as an egg yolk. So all of a sudden their brain is just getting all these nutrients. So is it coming off the statin or is it just this nutrient dense, higher healthy fat way of living that they've incorporated? Their brain is now just sucking in all these nutrients. It's probably a combination of both.
There you go. Yeah, well explained. I love that.